medical issues again. Welcome to Flashpoint again.
Thank you. Thank you, Mr. Secretary.
Thank you. Mrs. Reed is an acupuncture specialist, and she will tell us more about her clinic again today and some specific illnesses that she treats there. Now, please let the public know who you are once again.
Okay, thank you. I'm Mrs. Helen Reed from the New Hope Clinic, an acupuncturist. New Hope Clinic is a medical acupuncture clinic that caters to the Liberian public.
Okay, we will be. We're not going to be too specific today. We're going to jump from place to place. Let's start with back pain, a very serious problem. One time I gave a help tip on Trip FM, and when I went to LBDI, a lady said to me, "You were on the radio. You said people are too lazy. They sit too long. This is why they have back pain, especially lower back pain." She said, "Mr. Cote, it doesn't matter that we are lazy, but the nature of our job, we sit too long every day." And she said to me, majority of our colleagues who retired from here all left from here with back pain. Now tell us a little bit about lumbago, back pain.
Lumbago back pain is a condition in which there is pain and strain at the lower back. And this condition is more common among, like you said, the lady told you, depending on your career or the kind of work that you do, or depending on your activity. This condition is more around those kind of people, and is kind of a common among older people.
Okay.
But sometimes the condition of arthritis can cause back pain. Even if you are not somebody who is sitting, you are not a secretary or maybe a teller in a bank or somebody who is doing paperwork and sitting all day, if you can be moving around. But arthritis itself is one of the manifestation of arthritis that we can see is also back pain.
Mm-hmm.
And there are risk factors when it comes to back pain.
Okay.
Yes. When somebody is obese, when you are overweight, there is a tendency for you to, that your body will not be able to hold the weight, and then you will have pains in the back. Okay. And sometimes if you are physically inactive, like we say, people who are just sitting in one place,
no exercise,
and sometimes no exercise, but because it is the nature of their job. But if you are conscious about it, you can find time to do exercise. You can do your exercise in the morning and in the evening, and even at your lunchtime. For some people are workaholic, they can let it work every day. They will just hang on the table and just eat small things. Then they come right by and sit down the next 5-10 minutes. But if you're taking your 1 hour for lunch, you would get up and stretch yourself, and then you find something and eat and walk around, and you come back and do your work, and then you do your exercise in the morning and in the evening. So actually, when you are physically inactive, it can cause back pain.
I see.
Yes, and sometimes depending on your occupation factor. Example, if you are lifting up heavy thing, or you are bending always, or maybe you are always twisted, you can have back pain. Like doing those things nowadays, teachers, the student will be having books, and then you can sit and then you read together. But during our time of teaching, the teachers used to get short time because they will stand on the board and they will be learning, writing everything on the board. When you teach that for 10, 15 years, 20 years, you will come up also with back pain. Yeah. And sometimes the stress level, people who are stressful, maybe occupational stress, maybe home problem, whatever it is, but stress of any kind, you can also develop back pain. Yeah.
Okay. Now, what happens if back pain is not treated early? Maybe you have it and you're sitting there only taking tablets. You're taking the tablets and you're still sitting for hours. And like one politician said one time, Alexander Cummings, you cannot keep doing the same thing over and over and expect a different result. Now you are sitting for hours, can't even walk around, or you're doing some other things that can create a back pain, but yet you're only taking painkillers and still doing those things that you're not supposed to do. What if it continues like that for a long time without being treated? What happens to the person?
If the back pain is not treated for long, the first thing is it restricts your mobility.
Okay.
You will not be able to walk. It restricts your movement. To be able to walk hard. Those of all who are charismatic people, charismatic pastors and charismatic church members who likes to pray and move around, time for prayers and intercession, you will be moving around. You're supposed to stand for something like 20-30 minutes, 1 hour to pray. If you have back pain, you will not be able to do those things again. If you have back pain, maybe you will not be able to move around to do the kind of work that you're supposed to do. You say maybe you work in a shop and you have back pain. You will not be able to move up and down, say, oh, go get the other goods, get that other item from here and there. It will be difficult. If you're an athlete, somebody who is playing sports, and you develop back pain, you need to treat it. And if it is not treated, you will not be able to play sport effectively. And in so doing, when you continue, you will not be able to walk. We have seen some people who got arthritis and they are being restricted to the wheelchair. They will just sit down. Their bike can stand again. They will just bend. Or maybe if they're walking, but then they are bending with a stick and walking. Those are complications of back pain.
I see. Can children suffer from back pain too?
Children?
Yeah.
If children are suffering from back pain, maybe it's back pain from injury.
Okay.
For example, if the child fall down, if you have a 10-year-old child that is climbing and fell down on their bike will hurt. They will be suffering from that back pain because of the injury. But back pain mostly is you find it among older people.
Okay. Okay, now let's deviate a little bit from lumbago or lower back pain and go to numbness. What causes numbness? And what is numbness? What causes it?
Numbness is the condition in which you do not feel certain part of the body. Yeah, for example, the hands, the fingers. If your fingers are numb, when you do your hand like that, you will not feel. You will not feel that part. It will just be like when you are rubbing things. But to say you know that you feeling like normal feeling will not be there. And numbness can be caused by some varieties of conditions. Sometimes a patient may experience numbness as a complication of some disease condition like diabetes. And that means to say your nerves are involved. It can be a complication of hypertension. It can be a complication or it can be a sign and symptom of arthritis. So there are many things that can cause numbness. And that's why when you have these conditions, the best thing to do is to go to a hospital where the clinician or the medical personnel will check you, maybe order you to do some laboratory work, and then you will come up with a clear diagnosis and they will start your treatment.
Okay.
Yeah.
All right. Let's come to another thing again. The main thing that most people know your clinic for. In fact, some people call your clinic the pressure clinic, and sometimes they call it the stroke clinic. And I'm sure it is so because you treat stroke successfully there. Let's talk a little bit about stroke. What is stroke actually? We have said it here many times, and the reason why I sometimes bring in stroke when we're discussing other topics. Most people have stroke today and don't know they have it. And sometimes it is too late. There are millions of people around the world today who are now permanently disabled, sitting in wheelchair. Those who can afford to buy a wheelchair, they're lying down there, can't move. So, what is stroke actually? How does it occur?
What is stroke? And the thing is, you said many people have stroke and they do not know, which is really true, because sometimes when people have stroke, they say, well, because maybe I got a promotion in the office, so somebody put something in the seat for me. Sometimes that what can happen. They say, oh, something, they learn, they say, well, we were talking, the people put something down for me to walk on it. They got all type of beliefs when it comes to They got all type of beliefs when it comes to stroke.
Yeah.
So, stroke is a condition in which the blood supply to the brain is cut off. It is cut off. The blood supply to the brain is cut off because either the vessels that supply the blood to the brain, the vessel is blocked. The blood is not passing through a good or successfully or correctly to go to the brain, and the blood carries oxygen. So if the brain is there, it's not getting oxygen, then there will be a condition that is called stroke. Or maybe the vessel is ruptured. If the vessel is ruptured, then there is what we call hemorrhagic stroke. Yeah. So stroke is the condition in which the blood supply to the brain is cut off.
Okay, but when you say rupture, you're talking about burst in the brain?
Yeah, it bursts, yeah. When the vessel bursts.
And what do you call that type of stroke?
We say hemorrhagic stroke.
Okay.
Ischemic stroke is the condition in which the vessel is not ruptured or is not burst, but the vessel is just blocked. Yes. So when the vessel is blocked, if it just happens suddenly and then it comes by, sometimes that's why it does. Or sometimes it happens and it takes time for it to, for the blockage to be removed. So whatever the condition is, it's better to consult the hospital.
Yeah. Now, some people, like I said from the beginning, have these things and don't know they have them until it becomes worse. What are some signs and symptoms that you can tell us about that when we see, we should rush to the hospital?
Signs and symptoms of stroke.
Yeah.
The person who has stroke, when you have stroke, you will see that it will affect some part of your body, like your mouth. Your mouth will be twisted. We call that one the wind stroke. Some people have stroke, their hands, their foot, everything already walking normally, but their mouth is twisted. Sometimes you have stroke, it affects the speech center. We are seeing several patients that they will come and say, nothing happened to the person, the woman get stroke because she didn't get pressure, we can call pressure stroke. The woman get pressure because she walking already, but she able to talk, the talking, they even know that stroke affect the speech center. Okay. Yeah, sometimes the people get stroke, it affects their hearing. Yes, I mean the person will not be hearing correctly. And when patient gets stroke too, you will see that either one side of the body is weak or is numb or is heavy. So most of the time when the patients come to the clinic and tell me, say, oh, my foot and my hand, that my foot and my hand, I get problem with, I can ask them what happened to the foot. Is the foot painful? Is it heavy? Is it numb? Or is it weak? Depending on what is happening to the foot, then you will be able to know what to check for. If somebody come and say they ain't able to walk because they got too much pain in the foot, my foot is very painful, so I'm able to walk. You will not be checking for stroke. You will want to check for acute arthritis. You will want for them to do either when they ordering the test, you will order the uric acid and other tests to know how the uric acid level and other things. If the person say the foot just heavy, unable to lift for the foot, they just like light down in the foot, then you want to look at the person pressure, you look at they do the sugar and other things. Sometimes two things that have come nowadays in our society, people can be wondering about what the cholesterol was here first time. We never used to hear about it. I can tell them, I say cholesterol being there as an illness, as a condition with human. The only thing is because people never used to test it to know. But the sign and symptom has always been there. It has always been there. So most of the time too, it may be widespread now, it may be too much now because of our eating habits. Because most of the time we eat too much oil. And most of the oil, the commercial oil that the people face, the argo oil, they got too much cholesterol in it. So like that, when you eat it, it's hard for it to absorb in the body, and then it will form excess of the fat. And sometimes these things are the things that you check for when you see patient what got sign and symptom of stroke. Because if the cholesterol is too much in the vessel, in the body, that means to say the pressure will be hard to go down. The pressure will not be reducing.
Okay, I also heard that high blood pressure is one of the reasons why people can have stroke, because it affects the blood flow.
Yeah, high blood pressure, when somebody's pressure is very high, that's the main thing that can cause stroke, because when the pressure is very high, it will not be the vessels that the blood is passing through. Once the pressure is high, the vessels will rupture or the vessels will be black. Most of the time, hypertension can complicate into hemorrhagic stroke.
Oh.
Yes.
Okay. All right.
Yeah,
Now,
sometimes when the patient is developing some heart condition, it can also develop into ischemic stroke.
I see. So it's always advisable to check your blood pressure always.
Yes, it's always advisable to check your blood pressure. That's the reason why blood pressure taking is among the routine, the common routine examination in the clinics and hospitals. Any clinic you go to, you have to take your pressure.
Now, do you have a standard laboratory? Most people do guessing work around here. I'm not going to name anybody, but we know about some herbalists. I'm not trying to disdain or make demeaning comments about herbalists, because even the World Health Organization recognizes herbalists or traditional medicine.
Mm-hmm.
But too many of them are coming up now. Not those ones that are recognized by the WHO and our health ministry. Anybody can treat anything now. Sometimes one person sits in a place, they can treat over 100 illnesses. Now, do you have a laboratory? Because medicine business is not guessing work. Do you have a standard laboratory where you do tests before treating your people?
No, medicine business is true. It's not guessing work, and to confirm the diagnosis and other things, it's good to have a well medical laboratory that they will do the lab to do. So it's true, we have a laboratory. We have a laboratory that we can do some routine labs, some chemistry like PSA or we can do the sugar, we can do the cholesterol, we can do uric acid and other things. But to answer your question, yes, we do have a laboratory. And when any patient come to us, when we assess the patient condition, we take down your sign and symptom, we take down your history, and we see what is happening to you. We will send you to the lab. After the laboratory test, then we'll come up with a diagnosis that we are convinced is confirmed. Then we will start the treatment.
When you talk about PSA, are you talking about prostate test?
Yeah, prostate test. We do prostate test at the clinic too. Some men will come depending on the way I can urinate faster, or The thing about it, when it comes to prostrate, yes, the urination is, but the urge come fast because the urine is not able to come up freely. So the urge will always be there. So we'll do all the tests to find out. And sometimes when we got patient with sterility or patient with infertility, more especially men, we also like to rule out these conditions. So we can do the PSA, we can do sugar, we can do other things to know.
Okay. You talk about infertility. Let me ask you this. Like I said, your clinic treats many things. The Chinese people say acupuncture treats over 300.
Yeah.
But the WHO recognizes 47 areas.
47. And among the 47 that the WHO recognize, it's not all that we treat at New Hope.
Okay.
But I can assure you that some of the very common illnesses in Liberia, we can treat them.
Common or major?
Major. I mean, when I say common, I mean all around you can see it.
Yeah,
if you get up, like about 5 person in this room, when you ask them, when you check them, maybe one person get backpain, maybe one person get migraine, maybe one person get hypertension and other things. So some of those things, those are things that we can treat in order to cut down the suffering of the Liberian people.
One of the major reasons why there are many divorce cases around the world today is sexual incompatibility. You can build a house for the madam, you can buy her new phone every week, you can roof her my house and do everything, and even send her abroad every month. But once you can't perform at home, she will leave. And this is the problem that is happening in the homes today. How effective is acupuncture when it comes to treating sexual weakness, or what medical people call erectile dysfunction?
Acupuncture is very effective when it comes to treating sexual dysfunction. Either sexual dysfunction may be erectile dysfunction, or it may be quick ejaculation, but whatever the form of the sexual weakness is or the sexual dysfunction is, acupuncture can treat it successfully. We also have some Chinese medicine that we can also use for sexual weakness.
Please do small thing for me before you go ahead. Here in Liberia, when we hear Chinese car, Chinese telephone, we dismiss them because we think everything from China is not good. So when you say Chinese medicine, can you clarify here that when it comes to medicine, the Chinese are one of the best? It's not like your telephone. No.
It's not like your telephone. When it comes to medicine, the Chinese medicines are very good, and they're not just good that we know, they are good on, what we just see from the theory. That's something that we have tried, we ourselves have tried. I myself have taken Chinese medicine before. We have treated people with Chinese medicine before, and we know how good they are. So Chinese medicine are very good. And when it comes to Chinese product, the Chinese product are classes. It depends which one you have.
Yeah.
I can always talk it. Even the common product, I bought one hair dryer from China before in 2008. Up to now, the hair dryer is still functioning.
Okay.
It's still functioning. We've been using it over and over, whole while, and it's still functioning. And I bought it in China. I didn't know that it's a special brand or something, but it was made in China. It was sold there, and I bought it there. So it depends the type that you want, because the Chinese are too plenty. So they make things in different stages. When you go, and they will tell you, please, this is a mass production. This is this thing is second class copy, or this is a first class copy, or this is these are the prices. So it depends which one you want, and you buy it. So when you buy them.
All right. I just wanted that clarification. Now please go back to sexual weakness.
So sexual weakness, like I was saying, we have the acupuncture can treat sexual weakness, but when you have sexual weakness, it can be all right for you to go to the doctor, whoever they ask, for them to check you. Because either you have the sexual weakness because maybe you have a long-standing STD or gonorrhea or sexually transmitted disease that have, complicate into sexual weakness, or maybe it's because of hormonal changes, or maybe it's because of stress. So until you can meet a medical practitioner that is sound, that knows what they're doing, and then they will assess the condition and come up with what is wrong with you. If it is because of the hormones, then you can know how to treat them. It is because of stress, then you will know what to do. So it's good to just be sick, like he said again, for you to go and just get over the counter medicine and just be taking it.
Energy drink can do it. Just by energy drink.
Just by energy drink.
And you don't even know whether you have diabetes.
You don't know whether you have diabetes that complicate into sexual weakness.
All right. Then you get more sugar.
Yeah, you know whether you got some nerve problem. You know what is happening to you. Or simple, maybe you are just very stressful.
Yeah, okay.
And then you when you're stressful, you're not functioning, your body function will not be too good.
Okay.
So you need to know these things before you begin your treatment.
Okay.
So that when the medical personnel know what is happening, then they know what to treat.
Okay. Now, we will take a short break, and when we come back, we're going to be taking calls from you, the listeners out there, and also the viewers. We're now on Facebook. We have 5.2K. That is 5.4K. And 5,400 followers on our Facebook page. That's my personal page. And then we'll also have you on Flashpoint page. So we'll see what's going big. So after we're going to pin this number for the studio. I think it's already there. Not the studio, I'm sorry, the clinic. It's there already. If you don't have it, we're going to give it to you. But when we take the break, after the break, we're going to come back to you. And the numbers you're going to call to participate will be 0-777-511-977 or 0886-511-977. Those are the numbers to call in studio so that you can ask her, the doctor, some questions. Thank you. Let's take a break.